Hi students, I am Rojit Ghosh, NS College of Pharmacy. So today I present the anti-anginal drug. So what is anti-angina? Anti-angina means the blockage of heart, like in our atherosclerosis, in the plaque formation in our artery walls. So that is called as an anti-angina. So now the anti-angina is the sign and symptoms like chest pain, it is the breathing problem and the tightness of in heart. That is the main sign and symptoms of anti-angina. So now the classification of anti-anginal drug. Now first it is the types of anti-angina. So first type is the stable angina, and the second the unstable angina, and the third one is the fringe metal angina. So the stable angina means there is a common type angina, means when the heart work is there in our body. So now in that times, so tightness or the heart breathing problem will be there. That is called as an stable angina. Now the unstable angina, it is 80% stroke. It is the mainly responsible for the unstable angina. Now the fringe metal angina is a very rare of fringe metal angina. Now the first classification of the anti-angina drug, like the anti-angina, and which medication will be used in the anti-angina drugs, like the beta blockers. First thing is to the nitrates like nitroglycerin. So now the second one is the beta blockers. Now the third one is the calcium channel blocker. Now the fourth one is the potassium channel openers. So now the give is the example of the nitrates, like nitrates mean isosorbide dinitrates, and the beta blockers mean atenolol, metoprolol, and the potassium channel opener means the nicodandil, and the calcium channel opener, like it is used to the hypertension like amlodipine, felodipine. That's all. Now the mechanism of action of the mainly beta blockers. So at first in the beta blockers means the beta 1 receptor are present in our heart like arteries or the veins. So first of all the beta blockers, it is highly block the beta 1 receptor in the heart, and the heart rate will be decreased. So when the heart rate will be decreased, the cardiac work also will be decreased. Now the oxygen demand will be decreased. When the oxygen demand will be decreased, the chest pain or the breathing problem will be decreased. So that is the main mechanism of the beta blockers. Now the third one is the mechanism of action of the calcium channel blockers. So first of all the calcium channel. So when the calcium entry in our heart, the heart is highly repolarized or the hyperpolarized. Hyperpolarized means the calcium contraction will be there. So when the contraction will be high, the oxygen demand will be increased. So when the oxygen demand will be increased, the blood is highly output in our body. So that time the heart will be, chest pain will be there. So in that time we will use the calcium channel blocker. So now the mechanism of calcium channel blockers, firstly it is the block the L-type voltage gated sodium channel. So when the block of the L-type voltage gated calcium channel, it will be decrease the influx, calcium influx will be inhibit or decrease in the smooth muscle, and when the smooth muscle, the calcium channel will be decreased, the myocardial contraction will be reduction. So when the myocardial contraction will be reduction, the oxygen demand will be also decreased. So when the oxygen demand will be decreased, the myocardial contraction or the myocardial infarction or the anti-angina or the angina will be decreased. So in that time the chest pain or the reduce the blood flow, that is the main mechanism of the calcium channel blocker. Now I come to the mechanism of nitrates, like nitrates mean isosorbide nitrate. It will be used to the sublingual route. Because of that, it is highly absorb the blood stream. So when the blood stream will be absorbed into the organic nitrates, so the dilate the blood vessels and decrease the oxygen demand. So decrease oxygen demand, that is the main mechanism of the organic nitrates. So this is the main class of anti-anginal drugs. Thank you.